positive overall survival rate in patients with advanced pancreatic cancer treated on metformin for diabetes mellitus. Diabetes mellitus is a risk factor in a number of cancers. Although the mechanisms of increased incidence of cancer with diabetes mellitus are not fully understood, insulin resistance, leading to hyperinsulinemia, causes upregulation of insulin-like growth factor, signaling pathway to increase proliferation and invasion of cancer cells and decrease apoptosis. At the time of diagnosis, only 10% to 20% of patients were eligible for curative surgery. The objective of the study was to understand the impact of diabetes mellitus on the prognosis of advanced pancreatic cancer. The status of diabetes mellitus is stratified in accordance with 2010 diabetes mellitus criteria, according to American Heart Association or American Diabetes Association. A total of 349 patients were enrolled in the study, in which 183 had concurrent diabetes mellitus. Out of 183 patients, 160 had pre-existing diabetes mellitus, and the remaining 23 had subsequent diabetes mellitus. From the 160 patients, 87 had remote onset, and 73 had recent onset diabetes mellitus. In the study, 41.80% patients were on the drug metformin. 45.50% patients were on the drug sulfonylurea, and 32.10% patients were taking the drug insulin. The statistical analysis included Kaplan-Meier method, which used for median overall survival. Fisher-exact test was used to know group difference in demographics and clinical data. Cox proportional hazard model was followed to know the effects of hazard ratio with confidence interval, and log-rank test was used to compare the survival of two groups. The software used was SPSS version 19.0. The advanced pancreatic cancer patients with diabetes mellitus had more survival rate compared to non-diabetes mellitus patients. The p-value was comparatively low in the cancer patients who were on metformin medication. The overall median survival rate was more in the diabetic patients who are on metformin medication. In the comparison of diabetes mellitus patients, the overall survival rate with metformin treatment was proved to be better. In advanced pancreatic cancer patients receiving palliative chemotherapy, metformin treatment was associated with longer survival rate. Patients with diabetes mellitus tend to survive longer than those without diabetes mellitus.